share with you. I have the privilege of working with Ontario's public safety professionals. And when we think about who we call when we have our worst day, it's our first responders, and they will often come running in when everybody else is running in the opposite direction. And being mindful of the fact that every roadway, every parking lot, every store, every school, every house, apartment building, industrial establishment, and farm within a response area is their workplace, that presents or can present some unique challenges when it comes to OSIs and PTSD. I'm happy to answer questions. I'll go through the presentation and I'll check the chat for questions as we go. There we go. All right. So thinking about who when we say PSP, who are these people? What do they do? So we're talking about fire, police, paramedic, corrections workers, as well as our communicators. So when it comes to firefighters, they, if stuff's on fire, they come. They will also come to technical rescues, like if you hear about trench collapse or confined space or that sort of thing, they'll come. Now, in our province, we've got about 30,000 firefighters, about 1/3 approximately are career firefighters who this is their full-time job. Most career departments in our province right now are working 24-hour shifts. So they don't have very many of them, but they're there for a good long stretch at a time. The bulk of our province, about 400-ish of our 450 or so fire departments are volunteer. Now, it's not volunteer in the way where you go to volunteer at your kid's school. These are part-time, often paid, on-call people who carry a pager on their hip, and at the drop of a button or I guess the sound of a tone, they will go running. So it doesn't matter if it's a chimney fire in the middle of the night or a car crash in the community during their workday, they will just leave this meeting right away because they are needed. When we think about the physical demands for these individuals, depending on the type of response they're doing, they're carrying 50, 65 pounds of extra gear with them. That's boots and helmets and their bunker gear, their firefighter coats and pants, as well as the SCBA, the air they're bringing on their back. When we think about police officers, depending on the real estate available one has around their waist and how much stuff they put up on their vest, these individuals are carrying about 20 extra pounds of weight in the course of their duties. And police, we've got the people who are driving around the community responding to the calls, whether it's, car versus bike or somebody stole stuff. Or break and enter, as well as the specialized units who may be doing surveillance or investigation of more complex cases, that sort of thing. When it comes, for police, for our sworn in civilian members, we've got about 35,000 of them in the province. Paramedics, there's about 11,000 in the province. Every call they go to, they're carrying about a 50-pound bag of stuff in addition to a stair chair, a stretcher, whatever they need. They may be going to that call where a person has collapsed between the little space between the tub and the shower on the 3rd floor walk up, or it may be right on a sidewalk or a roadway. Corrections, we have our corrections colleagues who are working in an institution. So they are going to an institution by choice daily to work with those people who are in custody. And it's not just corrections officers, there's social workers, there's chaplains, there's recreation, there's rehabilitation. So it's a whole suite of services in order for the institution to run well and rehabilitate those in custody. There's also those in corrections who are working out and about in the community. So thinking more about a probation or a parole role. And then we have our first responders who you will never ever see. These are the calm voice on the other end of the phone, the call taker who is getting all the information to establish a priority of your request for service, where it is happening. They're if it's a call for ambulance, they're probably giving you some really calm, good advice about how to care for that person or what to do in the circumstances. And then we have our dispatchers who are looking at the resources in the community, the priorities of the call, who's closest, who's already doing what, and dispatching resources, fire trucks, police cars, specialized units, canine, ambulance to the call. Those are the people you see and hear on the phone. There's also a whole support system behind. So if you think about people that, a cell phone or a car has been seized or a computer's been seized, there's people that are doing all kinds of cool forensic stuff with those devices, people doing internet searches when we're looking at internet child exploitation, some horrible images. There's fleet, so maybe a vehicle has just come back from a call and needs a good cleanup, or maybe some people have stashed some stuff inappropriately. There's logistics, there's fire rehab, so to prevent heat injuries from firefighters when they're at a long call, a big fire, they'll have people that will go and help with cooling and rehabilitation. Now, first responders or public safety professionals, they have, generally speaking, an infinitely variable workplace. At the start of the day, we do not know what is going to come down the pipe. And if you're working on something right now, a hotshot call might come in, and whatever you were just working on, just put on the back burner. That car accident, not a big deal. We need you over here right now because this is a higher acuity call. So when we're looking at the workplace, it is anywhere in the community that we serve. And it's not just where we're working and the type of call we're going to, but there's a whole bunch of other factors that impact mental health of our public safety professionals. So I'm going to have one worst day of my life. I'm probably going to call 911 on that day, and people are going to respond. Those people are responding to many worst day of my life calls, sometimes some repeatedly in one shift, but definitely hundreds in a year. So there is that repeated exposure. And also thinking about the bystanders. So the paramedics that are getting that individual from the lake, perhaps, that person might be cooperative, very forthcoming with information. There could be, just out of that picture, a family member who is just agitated, belligerent, rude, questioning the clinical skills of the first responders, maybe even potentially violent. So it's not just the calls that we're going to and the patient or subjects that our first responders are interacting with. It's what's going on just around the sides of that with family members. Is it a routine traffic stop and somebody says, yeah, sorry, I was speeding, or does it turn into a wanted person with a whole bunch of drugs and guns and all kinds of things that it's not just a quick traffic stop? So there is definitely repeated exposure. And there are lots of similarities with public safety professionals. We know they're all going to take notes. We all know they're going to have a parade or check-in, a shift briefing. We know there's going to be ongoing communication with dispatch. We know that regardless, they're going to be providing medical attention, different levels of care, but there are some unique aspects to it. Police, their surveillance, investigation, search, control, seizure, evidence management, maybe some pursuits or arrests. Fire, if we think about what's happening in Alberta right now, we have wildland firefighting. We also have suppression activities of structures. So if your house or the industrial establishment in town or the car on the street is on fire, there's prevention activities, fire prevention officers, as well as technical rescue for confined spaces, trenches, that sort of thing. And when we think about our paramedics, yes, they will treat, they will provide a high level of care, they will transport. We are also doing community paramedicine right now. So they are working with perhaps a palliative patient, a cancer patient in their home, in order to support that person and keep them in their home. So they are now developing longer term relationships with clients rather than I saw you for that call, I took you to the hospital, and then you were looked after by the nurses and doctors and other allied health professionals in the hospital. And I'm sure you've probably all heard about the offload delays that they are experiencing. They've arrived at the hospital, there's not the staff, there's not the beds available to transfer care so that the paramedics can get back out on the road and get going to the next call. And all of these calls, some of them are hot shot, high acuity calls that you're going to see on the news, and others are lower acuity. I dare say easy. I use air quotes with that, but more run of the mill calls. And when we think about exposure to potentially traumatic events, is what is traumatic for one individual may just be another day at the office. And we don't necessarily know what is going to cause one person to react differently than their peers, even if, you know, there's 4 firefighters on a truck and they all went to that same call. Now, when we think about health and safety, we think about the hierarchy of controls. Now, with our public safety professionals, can we even do the hierarchy of controls? Can we eliminate? Well, stop 911 calls, stop crime, stop exposure to potentially traumatic events is probably not feasible, but we still deliver the services to the community. Can we substitute? Can we substitute assaultive, violent, or belligerent people with calm, cooperative individuals? Could we substitute an impaired person with someone who is of sound mind and judgment? Not really. So what we're left with often is controls at the individual and administrative or program controls. So we still have multiple points of intervention. They're at a program level often, or they are at exposure reporting, screening calls, checking in with people, peer support, SOPs, SOGs, that kind of thing. And when it comes to mental health, my one colleague calls this the placemat. It's a buffet. There are so many points of intervention when we think about primary, secondary, tertiary prevention. We can intervene before that exposure has happened. So we know that you're probably going to see some stuff in your career as a PSP. What can we do prior to those exposures happening? For secondary prevention, an exposure has happened, you are having a normal reaction to an abnormal event. How can we help you as you're processing what you saw, what you experienced, so you can have that normal reaction to an abnormal event? Or tertiary prevention, the exposure has happened, there were clinical symptoms, the person got the clinical support they needed, and we're supporting them in a stay at work or return to work situation. And as you can see with those purple boxes, there's lots of points to intervene. And I'm just going to speak about one example with the limited time I have available to share with you today. I'm going to talk about job demands descriptions and how we can use that as a primary prevention tool or how we can use that as tertiary prevention, and some of the things that might be considered, that we might have to consider when we are working with our public safety professionals, that are different and unique from other workers in this province. So a job demands description is just that, a description of the demands of the job: physical, cognitive, sensory, environmental. It does not quantify risk. It does not say, here's all the great solutions we can put in place to address. It just says, this is what is required in the job. And when we think about how this is used or can be used, sometimes it's used by employers proactively. They understand what all the steps of the job are, what the demands are, and now they can say, we need to take a closer look over here. We need to do a risk assessment of that. Does our SOP or our SOG address this adequately? Often where they're used is in that tertiary prevention, that return to work or stay at work. So if an individual is injured at work, regardless if it's mental health or otherwise, when we have an understanding of the job demands, physical, cognitive, we know what it is we're aiming for when we are bringing this person back to work. The individual works with their healthcare provider and documentation is provided to say, this is what this person needs in terms of support. This is what their functional abilities are. And with those two pieces of information, then the employer can work to say, yes, we can return this person to their pre-injury job. We can return them with accommodation, or no, we need to look outside the pre-injury job or unit or department for a different job with or without modifications. And when we've done this, most of our work has been with police and paramedics to this point. Anyone who's been involved in return to work can see that these 6 boxes are an oversimplification of the process. There's lots of nuances in there when we are doing return to work. But what is important throughout this process, it doesn't matter to me what sector you are working with, what workplace you are working with, there needs to be good communication, there needs to be trust between workplace parties, and there needs to be appropriate accommodations so that there's suitable and meaningful work that will facilitate this person on their recovery. I had the privilege of being involved with some work done for the Institute for Work and Health, and there's a link in the top of the slide there. You can just Google Institute for Work and Health, police return to work, stay at work. And what came out of this work was the importance of one, understanding the context of the unique context of policing, but ultimately it came down to accommodation, communication, and trust building activities. And while the research was done with police only, and there is limited work when it comes to PSP on return to work and stay at work, themes we are seeing in another project that is coming out of Alberta with public safety professionals is there are similar themes and similar messages coming out. So I'd encourage you to take a look at that resource and see how much of it resonates with you for your workplace, and also to gain a bit of understanding of the uniqueness when it comes to our PSP population. Now, we're pretty comfortable with the physical demands of work and accommodation for sitting or standing or running or walking or ladder climbing limitations. As a society, we're comfortable with that. That's quote unquote easy. It's a known quantity, if you will. So in this case, if we had an individual returning to work who had some limitations with sitting, there's a couple tasks we'd be concerned about. We couldn't just return them to their pre-injury job. We would need to do a little bit of changes or accommodations around a couple tasks, transport, patrolling, surveillance, responding to radio calls in this case. Now, what about the person who comes back to work, and it may be PTSD, it may be a concussion, it could be occupational or non-occupational. What about the person who comes back to work with some cognitive impairments? They're not 100%. Um, Maybe there's limitations in this example with exposure to noise and bright lights and glare that causes headaches, or this individual who has challenges with memory and their attention span, sustained attention. So, with having the job demands description, we could look at if this person's job, regardless of what it was within our PSP organization, if that job task required procedural memory in this case. If it did, how could we support this person? And can we share this document with the healthcare providers so that they can make clinical decisions on the best course of treatment to support developing this person's procedural memory in this case as part of their rehabilitation plan? And then in the workplace, we can understand where they're at with their current functional abilities and work to support them in a stay at work or return to work process. So when this is just another day at the office, whether it's rescuing a trapped person from under a piece from an agricultural incident, whether it's a marine rescue, a shoreline or swift water ice rescue, or letting people know that this road is actually closed and you can't take your normal route home or your normal route to the doctor's office. Sometimes we have to be pretty creative when it comes to thinking about how we support through primary, secondary, and tertiary preventions. Um, the culture is important, and it's for all our PSP. We are working in a paramilitary organization, so that chain of command underlies everything within the organization and the culture. Um, so it's something that we need to think about when we're supporting our PSPs and the organizations they work for through their mental health prevention efforts with their primary, secondary, and tertiary prevention. I would love the opportunity to connect with people afterwards. I can't see the chat right now, so maybe Val, if you can share if there's questions.
I don't see any questions right now, and we are tight on time, but
Yep.
I'm very interested in the JDD use for primary prevention. Just primary prevention in general is something that we try to focus on and talk about, but what it really means in individual workplaces, and particularly in this context of where you can anticipate you can't avoid the trauma to some extent. So how do you and I'm not a, and I've always, like resilience is not, I resent that word because it's fix the worker instead of fix the work in the workplace. But how realistically can one, even our organization thinks PDD should be done in advance. So you identify what the risk factors are in a job, and you do everything you can to minimize them before you put anybody in that job, because that'll make it more productive as well as healthier and safer. So just maybe while we switch over to Sandra and Navi sharing their slides, maybe Tanya, can you talk about anything you've experienced in the primary prevention of using the JDD or other strategies, and whether that's been able to work, find some traction of identifying things and that have reduced the trauma when people got there, or the impact?
So yeah, if we don't say if we send a canary into a coal mine and the canary dies, we don't say we need stronger canaries, right? There's something wrong that caused the canary to die in the coal mine. So I agree that there's a time and a place for resilience and supporting individuals. I also think that there is a multiple points of intervention at an organization level. And my career is prevention. I would love to move things upstream. I think right now as a society, we're in the place where it's easier to have the conversation at that oh my goodness, this injury was happened. How do we support, or how do we return to work? Or maybe it's WSIB costs that are a driver and get people's attention. What we have seen with one organization, we did do some job demands descriptions for them. It brought some things to their attention, and they are looking at, we're working with them right now to develop some training modules and work on their SOPs for particular aspects of the job that do present a higher risk, so that prior to people going out, as part of their annual refresher training, as part of their onboarding for their new recruits, we're having conversations and resourcing individuals, and that the organization has thought about the risks and where we can mitigate that risk upstream.
Great. Well, I'm interested to hear more next year. You can come and tell us how that worked, or even the workplace. We would welcome them to share. And it's an iterative road, I think. But I really appreciate your taking the time to share your approach at PSHSA and all that you're doing to help people in the public services and public sector
Thank you.
who have to deal with these issues on a daily basis. So now we're going to switch gears to our next presentation, and we have Sandra Moll and Navdeep from McMaster University. Sandra is an associate professor in rehabilitation science, and Navdeep is a grad student studying for a master's in public health. And they're going to take it away. Sandra only has limited time, and then Navi will finish the presentation, and then for those who can stay, we will go after 3, and Kathy will give us a bit of a summary on maybe some things we can think about in preventing the impact of trauma, even anticipating that it may happen. Okay, Sandra, take it away. Thanks.
Thank you. So much to talk about. Just want to say thank you to Andy. You know, your story is really the reason why we do this work and keeps us grounded. So really appreciate that. We are really delighted to be here to talk about some of the really exciting work that we're doing to support the first responder public safety community. And the work, I just want to acknowledge, has been funded by the Movember Foundation, who are really giving back to the public safety community. And we've heard, thanks Tanya for giving a background about who public safety personnel are and the challenges, I think, of their job. They do really important work in keeping our communities safe, but often it comes at a cost. And if you look at some of the literature, there was a survey done of, I think, 5,800 public safety personnel in Canada, and the rates of mental health disorder are about 44% in comparison to 10% in the general population. So this is a group that is of high need, high risk for post-traumatic stress injury. And also this is a group that really looks after others and may be reluctant to seeking help for themselves. Lots of barriers, stigma being one. The other is really access to skilled providers, so that really understand the culture of public safety work. Our project was looking at how do we think about technology, specifically a peer support app, as a first line response to support the public safety community. So really that upstream work. In first responders or public safety personnel, peer support is quite well established in terms of the value that has. Peers really understand, like no one else does, the unique culture of public safety work. And we were interested in looking at technology to reduce barriers to seeking help. There's lots of potential for technology to make it easier to get on-demand support when and where it's needed, to ensure a private, secure connection to peer support, to reducing stigma and increasing accessibility. And also, one of the requests we had is to have some kind of a tool to enable systematic evaluation of peer support. So how it's implemented and the impact. And that's what we're going to talk a little bit about today around that work. And so about 4 years ago, we started this work. We actually had a small grant from CIHR at the time to co-design with the public safety community what it is that they wanted in an app technology. And so we ended up doing a series of interviews and focus groups in jails, in police stations, and fire stations around the province to sort of listen to what the pain points were for people and the solutions that they wanted us to build. In 2020, we were invited to join a national group, SUBCERT, Defence Canada, RCMP, who wanted to do this work nationally. And the pictures you'll see here is part of the design work that we were doing to really build the prototype of what it is that would meet the needs of the community. And we ended up doing beta testing across the province as well with the prototype that we had developed. Thanks, Navi. And out of that process, I just want to say many things emerged, but one was really about design principles. So if we were to design some kind of technology that would meet their needs, there's a number of things that we really had to keep in mind. The first and number one over and over again is whatever we had to build had to be enable a secure private connection, lots of concerns around privacy of personal mental health information. Needed to be something that was easy to use, something that was contextually relevant. So again, really customized to the public safety community. And Navi will share a little bit what the product looks like, but we had a lot of peer wisdom videos, evidence-based articles that are designed by and for the public safety community. We also did some thinking about how do we build a trauma-informed app. So, you know, if someone is really struggling, it's really hard to process information. So it had to be really easy to access, easy navigate to the information that people needed. Also, lots of conversation about how to make it safe. So to not be triggering, so not to talk about the traumatic events. It was going to be a strength-based app. Opportunities for choice in terms of who to access, when to access, what kind of services they wanted. So those were kind of principles that we really talked about throughout the process. Also trustworthy, transparent. Those are kind of key principles that led to the design of the app. And I'll turn it to Navi, who's actually going to walk you through what it is that we built.
Sandra, can everyone hear me okay? Yes. Okay. So there are actually two connected apps that we ended up creating. So there is the PeerOnCall Red app over on this side, and this is what public safety personnel in a given organization would receive, and they would be the primary app users. There is also a connected PeerOnCall support app, which is this blue one over here, and this is for peer support providers in the organization. So these two apps are interconnected, and it's sort of how app users are able to interact with peer support providers in their organization through the app. It's also important to mention that the app is organization-based at this point, so we give each organization an access code, and so they can put their own local resources, personalize it in that way. And you'd only be able to see peer support providers in your own organization, for example. So this is the Red app. I'll just be going through some of the important app features that we have. So there is anonymous access to text and phone. You have the option to text or phone a peer support provider, and it's completely anonymous. Like Sandra mentioned, there's access to peer wisdom videos and articles, as well as a bunch of different wellness tools that you can use. And I'll just go through those now. But so when you open up the app, this is the welcome page. There is a tutorial that sort of walks you through the app, an opportunity to give feedback, and this links our research with the app. If you look here, there's the option to connect with a peer, as well as a chatbot and a wellness log. And I'll just go through that now. So like Sandra mentioned, one of the important design principles of the app is choice. And so we really want to give app users a lot of different choices on what they can do when it comes to looking at these different resources and using these different resources. So if you didn't want to access peer support, you didn't want to text or call someone, there's the option to use this chatbot to streamline sort of the resources that you need in a given moment, for example. So if you texted the chatbot and you were having trouble with your sleep, for example, there are these choices that you have at the bottom that you can choose from, and they all correspond to these categories here. If you were having some trouble with your sleep, the chatbot would sort of populate all the resources in the app that relate to sleep in the chat itself. So it's just a way to go through those resources in the app. You're able to review those resources, create an action plan, and also to connect to peer support after reviewing if that's something you'd like to do. You're also able to rate the different articles that are on the app. There is also the Explore page, and this is where you would find those peer wisdom videos. So these are really tips to cope that different peer or public safety personnel or first responders filmed across different sectors. And so it can be helpful to hear a peer within a video providing these tips to cope. There are also articles and videos relating to peer support or public safety work within the app, and also local resources and content. This content is organized according to different search topics. So depending on what your needs are in the moment, you can choose different topics and filter that way. There's also the opportunity to set goals if that's something that works for you. Again, these are all different ways that different people can be reached with the app, because goals might work for some people or they might not work for others. Just depends on what works for you. So you have the option to set a goal associated with a topic. For example, a goal might be talking with a supervisor about strategies to manage work. And so there's that option. There's also a wellness check, which allows you to log your wellness over time and monitor your wellness over time. And you can sort of slide this back and forth depending on how you're feeling. And a wellness toolbox. So this is really where you would upload pictures, maybe of your dog, of your family. It's really meant to be a grounding tool in a moment of chaos. So that is also a feature in the app. And this is how you would sort of connect to peer support. So you would click on this support option here, get started. If it was an emergency and you clicked yes, you would be prompted to contact 911. But if it isn't, you would go through and be able to connect with peers this way. So that's sort of how the peer support aspect of the app works. And you would be able to chat with people anonymously or to call them. This is the other app. So this is the blue app for peer support providers. And the main thing I wanted to hammer home here is really that there are different features on this part of the app that allows peer support providers to protect themselves and their own mental health and create boundaries with app users. So it's important that we're supporting the peer support providers because they're also doing really important work and talking about different mental health issues. Okay, so switching gears a little bit into our implementation research. It's one thing to build an app, and then it's another to implement it in a real world setting. And so this is really why we are doing an implementation and effectiveness study of PeerOnCall across a number of public safety organizations across Canada. And we are hoping we've either sampled organizations and are continuing to sample organizations and are hoping to have 6 to 8 by the end of it, with a focus on diverse organizations. So diversity in size, location across Canada, as well as the sector that's represented. And in these organizations, we will be doing sort of a 6-month implementation trial period. And over these 6 months, we'll really be trying to answer 3 main research questions. And those are, how do employees utilize the peer support app? So really understanding patterns of app use. For example, do people call more or text more? Is there a difference in the age of people who download the app, things like that? And what shapes patterns of app use in an organization? So really focusing on the organizational context that the app exists in, and the organizational culture. And then finally, does the app implementation affect mental health literacy, mental health, or outreach to support? So those are sort of our three main research questions. And so we're collecting a variety of data from a number of different participants. The first are organizational champions, who are informal or formal leaders that are sort of overseeing implementation within their specific organization. And so we're doing interviews with these champions at baseline and at 6 months post-implementation to really understand what the organizational culture of their particular organization is like, as well as helping them to develop some implementation strategies and to understand sort of how communication works in their organization and how they would go about promoting the app. These champions also get a workplace environment survey that we will be analyzing. And then in terms of app users themselves, we are collecting baseline and follow-up surveys to track changes in those mental health indicators or outcomes I talked about earlier, including literacy, mental distress, and health outreach. We also have really great app utilization metrics, so we'll be able to look at adoption rates and how people sort of use the app and rate different features of the app. And then there are also in-app feedback surveys regarding the peer support service. So that was that sort of feedback button I referred to earlier. And then finally, we're doing focus group discussions with peer support providers themselves from different organizations, sort of just to get their feedback on what their experience was like providing peer support through the app. And then there are also some post-call action reports that peer support providers can fill out, and we'll be collecting that data as well. And then our analysis will really focus on understanding what works best for whom and in what context. So for the rest of the slides that I have left, I'll be talking about organizational champions because we are sort of at the beginning of our project, and this is actually what my thesis work focuses on. So I'm really interested in understanding how organizational culture impacts the implementation of the app itself. And so that's what I'll sort of focus on for the next little bit. So this here is just thinking about implementation science. There are a lot of different frameworks within implementation science that suggest different things influencing implementation. And I'll come back to this, but we really grounded our research in the CFIR framework, so the Consolidated Framework for Implementation Research, which has 5 major domains that impact implementation. And I'll come back to this. But so as of now, we have 3 organizations so far that have been recruited to this study. We have a large urban police service based in Ontario, a mid-sized urban paramedic service in Alberta, as well as a small rural paramedic service in Saskatchewan. And we tried to recruit 2 to 3 organizational champions from each organization and tried to keep it so that we had champions who were sort of on the ground as peer support providers and had experience doing that, as well as people who were in more formal leadership positions, such as managers or, for example, a staff sergeant in the case of our police organization. And then, so we found, so far, we've been finding some really interesting things when it comes to understanding the culture of public safety organizations and how that might influence the implementation of this app. And I'll sort of talk about this with regards to that CFIR framework that I was talking about earlier. And so in terms of the inner setting or the culture of the organization itself, I was actually really surprised to find that, and happy to find that champions mentioned that there has been a really big shift in their culture lately for the better when it comes to mental health. And so this police champion really described their culture as bright, and that this was really influenced by really great leadership coming into the organization who wanted to increase openness around mental health and really reduce that stigma for their employees. In terms of the outer setting, or thinking about the larger context in which the organization exists, the first responders that I spoke to talked a lot about how stressful COVID-19 was and how stressful that experience was really influenced them to start talking about mental health a lot more. even if it wasn't something that they were inclined to talk about earlier, just the stress of it really brought people together. So that was identified as a positive outcome of the pandemic. So there was that. There are also the characteristics of the individuals themselves that we have to consider when we're implementing. So one paramedic mentioned that they thought that paramedics were actually quite apathetic and mentioned this to be an EMS thing or an emergency medical services thing. And so that's something that's really important to consider when we're implementing in this organization, for example, because we're going to want to figure out ways to really engage those people if this champion thinks that a majority of their staff is apathetic when it comes to new innovations, for example. Like we mentioned earlier, anonymity was something that came up a lot in the co-design process, and it was also something that came up in our interviews. So champions really hammered home that when they were wanting to promote the app, the messaging that they would really focus on is that you are anonymous when you're on the app. No one will know like who you are when you reach out. So that was something that they were really going to focus on in their messaging, and something that they thought would really influence use of the app. And then finally, in terms of the implementation process, champions talked a lot about how they wanted to actually engage informal leaders within their organization. And so we're realizing that informal leaders are really important when it comes to increasing app use. And one champion actually talked about how it's almost like if you were to hear from your family that something is good, you might be a bit more inclined to try it than if you were hearing from a stranger that an app is good. So those are our preliminary findings on culture. And so our next steps are really to continue that analysis and recruit additional organizations to the study and reach that target of 6 to 8 organizations. Continue to roll out the app in participating organizations over that 6-month period, and then collect that app utilization data. And then finally, we're hoping that by the end of all of this is sort of the big picture goal of the app and the project, is to generate recommendations to optimize implementation and impact. So again, just really trying to understand what works best and if the app is useful to people. So that's all I have today. I am open for questions if we have time. This is also our contact information in case you wanted to reach out to us. This is the app's website, and then my contact information as well as Sandra's.
Thanks a lot, Navdeep. Super interesting to me, I think. So I'll be really interested in the results of your study. Even the implementation stuff, I think, is really interesting, because I was already wondering when you mentioned the word anonymity, because I was already wondering about, like, if you're doing a pilot, how much are the people thinking, well, I don't want to be a guinea pig, they're watching me, right? So I'm just gonna whatever, it would make them guarded about their engagement with the process, and certainly about their candor in sharing things. But I'm assuming that there's still that you're tracking things, but it's anonymously, so you can't and that you must be able to sort of assure people of anonymity all the way through in order for that to be a real test.
Yes, for sure. So that was, again, one of the really big features that came out of co-designing the app. People really want to make sure that their data can't be tracked. So we've been trying to stay transparent in terms of the personal data that we are collecting and aren't. And so, yeah, it's a completely anonymous app. People won't know who you are unless you actually tell them. That's also why we sort of switched to using an organizational access code rather than having people log in, so that people would feel more comfortable logging in that way. So yeah, something we're definitely taking very seriously in terms of rolling out the app and in terms of our research protocols.
Thanks. And Siad has a question. Did you have design considerations allowing one employee to voluntarily submit data to return to work case management, proving they are trying to mitigate their condition, and to case manager to require proof of use of app. Those are two interesting questions in terms of its use as a tool, essentially, in return to work situations.
Can probably speak to that, and then I'll pop off.
Yeah, thanks.
So it was designed to be an upstream intervention, so early intervention and support. That doesn't mean it couldn't be relevant to someone who is returning to work and feels isolated. So we haven't really designed it to be part of a return to work case management plan, although there's certainly lots of evidence around app-based technology and e-mental health supplementing and supporting people in that process. So I'm not sure if that answers your question, but I think really it would be up to the person to decide if they're going to disclose that they're using the app or how they might use that.
Thank you. And oh well, and Sandra, you have to go. So I just also wanted to applaud the knowledge activism, which you called key inform. No, what did you call it? Your
co-design.
Well, no, but also the that Navi, you talked about that you needed champions, not just a champion, but you needed other supports in mobilizing the use of the app in an organization, which we believe in worker knowledge activism, so that they would educating workers, and then who are keen and understand the workplace, that they're tremendously valuable in engagement and mobilization, actually, of all kinds of prevention strategies. So it sounds like the work that you did with the champions that you already talked about that, I think, right?
Yeah, informal leader is really important when it comes to implementation and really getting people to use the app. Yeah.
Well, even the concept, it's not just the tool, it's the concept of sharing information in a way to hopefully offset the toll it's taking, or help others in the process, right? So now I do want to say thanks to both Sandra and Navi for sharing, for all the work they've done on that. It's been a long process, and it's really exciting to see that you've got 3 workplaces engaged, and I'm sure you've got some hooks out there for others. So and I don't know if you're interested in anyone contacting you, if they're interested in their own organization or not, but we will post your slides, and I think your contact information is there. And now we have run over, but Kathy is here and willing to talk to us about, as her slides say, worker trauma response planning, and be prepared to respond to trauma beforehand. And I think that's one of the things this whole session is about, is what can we possibly do in all of our things that we try to do in crisis response, crisis management, to anticipate and hopefully mitigate, if not prevent, trauma in the staff who are responding. So Kathy, take it away.
I'll take it away. And I will promise. No, it's okay. I'll introduce myself.
Okay.
I'm Kathy Martin, and I'm with the IHSA, the Infrastructure Health and Safety Association. So Andy had mentioned coming from the electrical utilities and working actually with IHSA. And so, yeah, we service the transportation, electrical utilities, and construction health and safety here in Ontario. So I'm here to kind of change things up a little bit, but we've heard a lot this afternoon around trauma, right? And the impact it's having, and the need to offer some support. So the app, great. I think peer support is definitely something we need to do. And we know those who are in our emergency response, our emergency personnel, they certainly need support. So a little bit about me. I actually was co-chair of the paramedic psychological health and safety standard back in 2008 with CSA. And prior to that, I had been working quite a bit with organizations across Canada, both the emergency response organizations, but just all organizations. When I worked with the Canadian Mental Health Association, I always say back in the day, that was in 2000. 5, 6, 7, 8, 9. I worked there about 10 years. So I'm really passionate about everyone having some protection in the workplace. So psychological health and safety is something that sure workplaces are talking about a lot more, but the responding to trauma and getting prepared to respond to trauma is one of those things that we tend to forget to do. We forget to plan on how to respond. Of course, our emergency responder community, they for some time now have realized they need to support their workers more. But folks like construction, like in the Andes of the world, working for IHSAs and working for any organization, working for an office, we don't tend to think in the same way. So I'm here just to talk really brief about some things you can do. So hold on here. I got my thing to actually move here. I guess I got to use this cursor here. So I won't go into too much here. I will promise to get you out here at 3:30 because I know we're keeping you over time. But critical incident, as you know, can happen anytime, anywhere, any place, right? And it can come in many forms. And it usually is something that's sudden, right? Or unexpected in nature. It's those worst days, as someone had said earlier. And it often involves traumatic stress, right? And that traumatic stress sometimes can involve mental harm. That can sometimes be harmful to our mental health as well. So just a real quick recap, traumatic stress. We all experience traumatic stress differently. And we're not talking about the day-to-day stressors of life, you know, picking the kids up at, you know, like at 3:30 and the session's gone over and you're trying to get out. You know, it's not those kind of day-to-day stressors. Traumatic stressors are those really intense emotional times in our life when often we fear we may have impending death or serious injury occur or may occur. So I had a little visioning exercise, but in essence of time, I'm going to actually skip through this. But this is a little guy crossing Niagara Falls. And so you can imagine that that might be a little bit of traumatic stress for you if that was what you had to do for your job. But it's normal to take time to recover when trauma does happen. And I think that's really important for workplaces to know. So like right after a trauma, it's going to be hard for anyone to stop thinking about what happened. And stress will gradually decrease over time for most of us. So that's our normal physiological body response to have that traumatic stress response. And that will fade over time. And I think that's really important for folks to recognize. And now the type of situation sometimes can lead to further trauma. And so what I mean by that is sometimes if the situation is highly charged with something that's maybe stigmatizing. So I want you to think of like a fatality maybe from impaired driving, for example. If you were the impaired driver, that might be fairly traumatic. It would be traumatic if you were fully sober and you know, you had a fatality and you took someone's life from driving, you know, fully sober and you made an accident versus impaired. So those the type of situation can either add further trauma. And also, it's important to know that there are things that can help people recover. So there's a link here. You will have access to the slides. I would encourage you to have a look at this website here. It's the International Society for Traumatic Stress Studies. They have some great resources. Here's a few things. Again, I'm not going to go through this in detail, but social support is key. So we've been talking a little bit about that today, the importance of social support. Andy talked about it in his talk. The peer support app is certainly built around that whole concept of providing some supports to folks. Getting back to one's life is really important, not necessarily avoiding those reminders, but trying to just get back and get into a routine. So we do want to have early return to work when appropriate, but you know, making sure that it's done in an appropriate manner, right? And making meaning of what happened. And so that's really important for what we call traumatic growth. We really need to make sure that people are finding ways to move through that. And that's when some good therapy might be good, but even good social support. Anyways, there's lots of stuff there on this slide. I'm sorry, I'm kind of rushing through this. I do apologize, but I know we've gone over. So anyways, crisis management, there's some key principles to just planning for crisis making your crisis plan as an employer or for a workplace, you really should be looking at these 4 key areas: prevention, preparedness, your response, or that incident management piece, and then the recovery piece. When you're building a comprehensive incident response program, again, you should be considering these 4 interrelated phases in the preparedness piece. So when you're preparing, you need to think about what is it we might need when it comes to being aware. So I think some organizations, I'll use construction as an example because that's one of the areas I focus in on. We can kind of predict that there might be a trauma during some of our high risk activities. So a fall, right? Falling from heights. We have a certain awareness that these things happen on construction sites. So knowing that, what's our prepared plan, right? So we have that. We send in the investigators, the Andys of the world, maybe to check in on things, and we educate people on how not to fall off a ladder, or how not to fall off a roof. And so we have these types of training, but you can also do training when it comes to preparedness on how to respond to the work or trauma. So I want you to kind of think a little bit outside of the box. That kind of awareness can be training the supervisors and the managers how to check in with staff, how to know when traumatic stress might become problematic, things like that. So to think a little bit beyond that when you're making your plans. Again, facilities and equipment. When you're thinking of your regular emergency response, we think about having fire smoke detectors and fire extinguishers, but there's things you can have ready at hand, and those things are resources, some pamphlets, some things to hand out just at the time of an emergency. You don't necessarily want to be thinking about it, the day of an event or the day after. You want to have things sort of planned and ready, and we'll talk about that in a minute. And procedure and policy assessment, and then again, the plan itself. So when it comes to responding, when you do your incident response or your emergency response, usually you have this thing called the command system. So most workplaces, who do you call when something goes off the rail and there's an incident? Usually there's a response team, and that would be that incident commander gets called, and then they kick in the plan, right? They initiate the plan. And I'm just trying to add an extra layer here to the system that most workplaces use already. It's like, make sure under your operations, you have a trauma response plan in place, okay, under that operation. So you know exactly what you're going to do at the time of an incident. Because at the time of an incident, it's not the time to try to think about what you should do. You should have that already planned. So some things to consider: who's going to respond to those workers involved or impacted? What level of exposure is happened? So it may be like the Andy, the person who's responding to the incident from an investigation. They certainly have a level of exposure. The person who is injured, or maybe the family members, it could be the workplaces. So we need to look at what are those different responses for those different levels of exposure. How do we want to respond if it's involving the community? Do we have to have a community response? Again, looking at the workplace investigation process, usually we have that all planned out, but are we planning for the worker trauma in all of that? The investigation process in itself is traumatic. So how can we look at that process to make it the least traumatic as possible or stressful as possible? And are we supporting those who are doing the investigation? So again, Andy's story is very poignant for this, like, send in the investigator, but are we looking at how that's impacting? And similar with our emergency response personnel, right? We send them in, but it's taken many years for us to realize that maybe we need to put in some supports. So again, having some resources on demand ready to go for in your plan is really good. Again, as I mentioned, those underlying stigma or social norms are surrounding the event. Is there anything at play? Making sure that there's a cue in your planning, just for those who are responding, like to look at, is there something sensitive here? And again, crisis intervention, it's always really good to sort of have some guiding principles to support your plan. And so I won't go through these. You'll have them in your handout, but keep things simple, keep them brief. Your plan should be, you should be innovative at the time of an incident, pragmatic, of course. Yeah, I'm rushing because it's getting late. Again, there are some models out there in showing how to engage at the time of an incident. So if you're a manager or supervisor being asked to go in and respond, there are some models out there to you can look at following. This is one organization that can certainly help with that. It's the International Critical Incident Stress Foundation. They're all about how to deal with critical stress or that critical incident stress, traumatic stress. So definitely have a look at their tools and resources. They have a great app as well. There's some handouts you might want to think about. You know, simple things like, you know, what can you expect over the next 48 hours, 3 weeks, 2 weeks? You know, when should I be concerned? Because as I mentioned earlier, traumatic stress will, for most people, settle down. It takes time to settle down, get that heart rate down and decompress and kind of have a few sleepless nights, you know, as your mind's kind of replaying the incident. It takes time to kind of reset. But when should I be concerned? So there's handouts you can have ready in your response plan. So you're not struggling and looking for those things. You can have resources for spouses and families, again, educate them as well. Make sure you have your mental health supports, your crisis lines, your EFAP. So if they go home in the next few days, are really struggling, that they know where to go. I'll just keep going here. Almost done, just a few more slides. And again, the recovery piece is really important, right? So that's part of your plan. What are we going to do to support people after an incident? So we've heard folks talking about the accommodation, return to work process, but making sure that the culture too, I think we always tend to forget the workplace culture. Is it being supportive, or is there a blame shame mindset going on? You know, you just maybe caused an accident or something and there's somebody was injured. How are we supporting the workplace through those incidences? What are some of those underlying things that are bubbling along that we should be aware of? Do we have somebody who's appointed to check in? Is that the manager's responsibility, supervisor's responsibility, HR? Who's doing those follow-up check-ins? If you don't have like a crisis team, again, that should be planned so that everyone's aware and that training happening for them. Yeah. And of course, where to access supports if needed. So that's pretty much it in a really quick nutshell. So just be prepared, get some plans in place, get your training in place if you need to, be adaptable, be flexible in your response. There's no right or wrong way to respond to an emergency situation. I think we have to go with our gut in many ways and be adaptable. But it's so much easier to respond when you're prepared for that response. And again, like I said, follow up, and then make sure if you put in a plan and you use it, you have to execute that. You're looking at that and building that into your oh my goodness, I'm getting a little fried at the end of the day too, that you're looking at that as well. So if you implement something, if something happens, make sure that what you've implemented is working. And as I mentioned before, just remember that stigma and social norms and conditions around the incident can be actually an underlying factor for whether people are going to accept help or give help even in that matter. There's my name. Oh my goodness, there. I spewed through that fast, but I promised you I could.
Yeah, no, it's a great job, and it's very, it's all pause and reflect and think how can we weave it in, I think is essentially the consideration for the impact on all on health and safety professionals, on the individuals in the workplace who were part of the event or responded to the event or witnessed to the event, or that others or who's the disruption can be in a whole bunch of different ways and often unanticipated. So
Yeah.
the more you can do in advance, the better.
Yeah, I think it's about building it into your emergency response plan. Most organizations are legislated, depending on your size, to already have those emergency plans in place. So all I'm advocating for is put an extra layer in there, put an extra step, take that plan out, dust it off, and look at it through the lens of trauma support. like a trauma informed perspective. How can we do better to support those impacted by this critical incident, whatever that is defined as, because that will go a long way. It shows that we care. There's compassion, concern from the organization that we took time to have some things in place. Doesn't mean you're gonna be perfect, not gonna get it right every time, but give it a go. And it's amazing when I've gone around talking about this, I get people to raise their hands, like who has this in their plan. Usually out of a group of maybe 50, I might get 10 that'll raise their hand that have a response. So we have a long way to go, I think. Like I said, the first responder community definitely is probably more advanced. And I think, they still have a long way to go to really nail this down. But I'm looking at, the broader sectors in Ontario in particular, and high risk organizations like what we serve at IHSA in the construction, transportation. They see a lot of trauma, a lot of events, a lot of accidents. And yeah, we expect them to be tough guys because they're, in truckers and construction, but you run over somebody with your transport truck, it's pretty traumatic. And there's a lot of impacts there. So anyways, thank you for letting me speak today. There's my contact information. And yeah, well, I apologize we went over, but hopefully you all enjoyed listening to Andy. I know I did. And yeah.
It set the tone, right? I mean, it wasn't just not trivially to set the tone. It really brought it home, I think, for all of us on the real life impacts and how long they can last and how important they are to try and recognize and hopefully reduce the impact in all the and there's no one answer either. I think it's a breadth of effort, but always remembering the concern, I think, is the big part of it. So I did actually want to ask a question about critical incident stress debriefing, because some people think that they thought that that's the magic bullet. We're going to all sit around, we're going to set a time and we're going to sit around, okay, 11 o'clock, 48 hours later, whatever, and then we're going to solve it all, right? We're going to share it and go home and everything's fine. And I think that
and I think you have to take it in context too. Critical incident stress briefing is a tool amongst a toolbox of tools you need to implement, and I don't think I definitely believe that not every incident requires that level of response, and it can be helpful in some situations and very detrimental in others. So you have to know your organization, you have to know your people, and there is lots of research on there. So I would encourage folks to, can at this time of day really talk about that, but to do your research, look at the Incident Stress Foundation. They're very open about sort of the dialogue around some of those issues. But at the end of the day, one-on-one checking in, leaning in instead of running away is really important. And I think that's, the intention of it is to lean in collectively. Can we come together and lean in and support one another, not to rehash the nitty gritty and certainly not to get into investigation details, but how do we support one another? I think that's grown and evolved over the years, and there has been, to your point, some controversy. It is definitely not the be all end all. I've been trained in it myself. And it's good. It does build confidence for people who have to respond. So if you're the person that has to respond to these incidences, I think it's good training for people to have some skill sets to be able to go in. Because you don't all have an EAP provider that you can call in. And even those EAP providers to come in, you're still dealing with stuff for days beforehand. It's that critical response team needs that level of training. That's about it. So that they know when it's appropriate to call in. Because I think a lot of organizations think, I'm just going to call in the EP and they're going to take care of things. And then they'll come in and do a debriefing and nothing really happens because it's disconnected, right? And you need to have your own approach. Anyways, I'll get off my soapbox and people can call me if they have any questions. They can reach out.
Yeah, thanks again, everybody who's hung on. And of course, we have the recording then, so people can watch it later who've had to leave. Tanya, did you have something you wanted to add? Or even about PSHSA resources in related to any of this, or just actually normally at the end we ask the speakers if they have any final words about the sort of the subject or their aspect of the subject. Did you have anything you wanted
Yeah, so from my perspective, I think we're in the midst of a generational change, just like seatbelts, cell phone use, drinking and driving. I think this is another change of that magnitude. So I think while we may want to say we should be farther along, there should be less stigma, and we want to should all over ourselves. Really, if we look at how far we've come, even in the last 5 years or 10 years, a lot of progress has been made. That doesn't mean we need to stop right now and give ourselves a pat on the back and take the foot off the gas. But I think we do need to recognize the amount of work that's been done, the way conversations are changing, that we are talking about mental health, that we are talking about lived experience, that we're willing to engage in a conversation that isn't suck it up, buttercup, maybe you don't have the parts for this. That I see you as a whole person, and I understand that you brought your whole self to work today, and what happened at work today might impact the whole part of yourself, not that we're just leaving that part of work at home. So how do we look after the whole person? What they bring with them to work and what happens at work that then they take home at the end of the day. So I am hopeful.
Yeah, thanks.
I would
Navi, did
echo
you have
that.
yeah. Navi, did you have anything you wanted to add? I'm not sure if you're still there. Maybe not. Okay. We will turn it off and say thanks. Oh, there you are. Did you have anything you wanted to add, Navi, about the subject today or about? No?
Just wanted to say thank you for organizing and thank you to everyone who spoke today. That was really inspiring and I definitely learned a lot.
Ditto. I do thank all the speakers again and everyone who attended, right? Because it's we need the audience and the engagement with the audience to help us understand our impact and also hopefully to get sort of referrals and spread the word essentially, and then continue the dialogue, because I think, Tanya, your point about it's a continuum and we're still in the midst of the continuum, and we need to learn and we need to hear and we need to you know, absorb that and then reflect on that and then dialogue about it and then try and make a difference in different ways, try things and then research them and then come up with different products and results. So once again, thanks to everybody. And as I put in the chat earlier, next week is our last session of this this year's Epic Mayday, which had 7 sessions in total. And I look forward to we're going to talk about some programs and initiatives from some of our Health and Safety Association partners, and also a case study of Stress Assess, which is OCAU's survey that we have available as a free tool for workplaces if they want to try and figure out what's potentially causing stress with their own workforce, and then dialogue within their organization about what they could do to change that. So but that's all for now. So thanks everybody, and I'm going to try and turn off the meeting, but I may have to go out and come back in order to do that, since I'm not currently the host, so I'm only the co-host. So thanks again, and yes, we'll post the slides with the permission of the speakers. I'm sorry I spoke a bit too soon, so we'll have the video up. It'll be on Facebook right away, actually, if anyone's interested, and then it'll be posted probably by Friday on our website, on our YouTube channel. So thanks. Bye, everybody.
Bye. Take care, everyone.
And now I'm going to really turn it off. Bye, everyone. Thanks for joining.